The arrival of around 260 medical students that are coming home from Cuba. They've spent the last 5 years on a scholarship there studying medicine, and it's been a long journey for them. They finally come home. They were supposed to arrive early this morning and their flight delayed significantly. There in the picture you can see the Health Minister, Dr. Aaron Motsoaledi, just welcoming home those students, and so this scholarship that the students were on, part of the binational agreement between South Africa and Cuba, aimed at focusing on the shortage of doctors in this country. This program certainly has come under quite a bit of criticism, and it's actually going to be scaled back. They said that they would sort of stop the program over the next 3 years, but that's not to be so, but it will be scaled down. There in the picture you can see the Deputy President, David Mabuza, who's welcoming the students home, and they will be hosted throughout the rest of the evening. So this program started in 1996 under the tenure of the late former President Nelson Mandela and late President Fidel Castro. It was started essentially to promote primary health care, and it has shown great success when the students return. But as I was saying, that the program has faced some severe criticism over the years, with some calling for its termination. We've had critics, including the DA, and those fighting to secure places at local medical schools. As we know, it's quite a coup if you do get accepted to study at a medical school. But it's highlighted that one of the reasons that the department has not increased the intake of medical students at our universities, certainly the lack of facilities, the places available at local institutions, has led these students, our South African students, going to Cuba to study in Cuba. They've spent 5 years there in a medical school in Cuba before returning here to finish their training, which is exactly what these students will be doing now over the next 12 to 18 months.
How big were you when you went to Cuba? You were 18.
All right, we've also got in the picture the Secretary General Ace Magashule, who's welcoming home our students, and I just want to say hello to our editor Sophie Mokwena, who's with me in studio just to talk about this. And Sophie, I mean, there are challenges that lie ahead for these students. They need to be integrated back into local medical training, and you know, our medical schools are saying we don't really have the capacity to accommodate them. So there's been a lot of criticism to this program, and now that they've come home, there's still a little bit of anticipation.
Yes, indeed. You would recall that even the minister, some few weeks ago, the department indicated that they are going to revisit this program. It speaks to the challenges the health department is facing, and therefore many people are asking questions whether they will be able to find a place, particularly in institutions of high learning, to finalize this program, but also whether they will be able to be sent to different areas where they can be able to do the work, and also whether there is budget for them to be able to be compensated when they have now embarked on working in different parts of the country. And now you can see the minister is there, many people are there, the parents are there. It has been a long journey. I remember we went to Cuba 2 years ago during the funeral of Fidel Castro.
Yeah.
I was able to speak to some of the students. We were able to do interviews with them, and they were very looking forward to come back home to assist the country. And the type of training they have, it's geared towards serving the people. And they were saying to us then they are looking forward to come back home to be able to assist people, particularly in the countryside, in the rural areas. You see the MEC of Health from KwaZulu-Natal there. You can see Minister Motsoaledi there. You can see the Free State MEC, you can see the ANC Secretary General, all provinces represented.
Well, as you were saying, this is all geared around bringing skills back into the country. But this program, as I was saying, has received so much criticism. And so I suppose my question is, you know, what's the wisdom behind training doctors that in a country that has sort of a different disease burden, it's at a greater cost, than actually just training them here? Why not just make a greater capacity to train doctors here instead of at great cost sending them to Cuba?
That's the argument, but others are arguing that the Cuban system, you know, of training doctors, it's the best. You'd recall during the Ebola crisis on the continent, it is the very same Cuba that was able to assist the continent to deal with the issue of Ebola. And it was the first country to avail itself to assist the continent to address the Ebola crisis. As we speak now, it is not only South Africa that is sending students to Cuba. Namibia is doing the same, and Kenya has recently joined. I'm told that even Uganda is planning to do the same. So many countries on the continent have decided to also embark on this program because the way they are trained there, they are trained in such a way that they really understand service to the people, you know, Batubili.
But I mean, it does. Just reading here, it does cost millions. It's cost us actually billions over the years to keep this program going. So they are going to scale back, which it's been a welcome decision to scale back this program. All right, but that's where we have to leave it for tonight. But lovely pictures coming through of a joyous return for these students, many of whom haven't been back in the last 5 years or so. So very excited to see their families, and yeah, that's where we'll leave it for tonight. The full view back with you tomorrow from me and the team. Thanks for joining us. Good night.